Most people think high blood pressure is just about salt, stress, or getting older. But what if I told you you might not actually have a blood pressure problem, you might have a breathing problem? Hi, I'm Negin, your favorite nurse, yogi, and somatic healer, and I can't tell you how many times I've put on a blood pressure cuff on someone and asked them to take a deep breath, and they laughed at me. They literally go, haha, okay, sure. And they don't do it, but I have to force them to, and then they do it, and suddenly the numbers drop. And they look at the machine, they look at me, all shocked, and they say, how is this working better than all the medications I'm taking? If you've been struggling with high blood pressure, stay with me. This might change how you see your body forever. Today, I want to explain why breathing affects blood pressure, what actually causes it to rise, and then I'll guide you through a simple breathing practice you can use daily. But first, what is blood pressure? I'll tell you, blood pressure is basically how hard your blood is pushing inside your body. When it's too high for too long, everything inside has to work harder. Your heart, your body, your emotions even. It's like living with a constant tension on the inside. But here's what most people don't get told. Blood pressure is deeply controlled by your nervous system. It can usually be linked to stress, but let's go deeper. When your nervous system is stuck in fight or flight, your body thinks it's in danger. So it does exactly what it was designed to do. Heart rate increases, blood vessels constrict so they get contracted, muscles tense up, breathing becomes shallow and fast. This is great if you're being chased by a tiger, but not so great if you're just in public trying to get to work and live your life. When this stress response becomes chronic, because of trauma, emotional pressure, anxiety, burnout, or unresolved stress, your body forgets how to switch off. And that constant tension raises your blood pressure. Now, here's the part that blows people's mind. Breathing is the only system in your body that is automatic, like you have to do it, like your body will do it whether you like it or not, but it's also under your control. And that means your breath is a direct remote control to your nervous system. It's like, a TV remote. When you breathe shallow in your chest, you signal danger. When you breathe slowly and deeply into your diaphragm, so into your stomach, you signal safety. And safety tells your blood vessels to soften, to relax, to let the blood flow into your body easily. Now, do you want to know how you can press the right safety button? There's a nerve called the vagus nerve. It runs from your brain down to your heart, lungs, digestive system. It's responsible for calming your body down. When you breathe deeply and slowly, especially with longer exhales, you stimulate this exact nerve. And when the vagus nerve is activated, your heart rate slows down, your blood pressure lowers, your muscles relax, and your oxygen delivery improves. This is not magic. This is just physiology. I see this all the time at work. I put on the cuff on, the numbers are climbing, and I say calmly, please just take a slow, deep breath for me until the machine stops. They laugh every time. Then because they think I'm joking, because that's what you tell someone that you just want to calm down. You're like, take a deep breath, calm down. So then I have to tell them, please, the machine is exploding. Can you please take a deep breath? So then they do it. One breath, then another. And suddenly the machine beeps and the numbers drop. They're shocked. And I tell them, You didn't change your medication, you just changed the way you use your oxygen. And you might ask right now why oxygen matters. Poor breathing means poor oxygen delivery. And low oxygen will give stress to your body. So when your tissues, when your muscles, when your body doesn't get enough oxygen, then your body compensates by increasing the pressure. So it's not just about calming down, it's about using your breath efficiently. And now I want to show you a breathing technique that calms your nervous system, improves your oxygen levels, and supports healthy blood pressure. You can do this sitting, lying down, or even during your doctor's appointment, actually. Let's begin. Put one hand on your chest, one hand on your belly. Now, notice when your breath is going right now. Just do your normal breathing. Now, gently inhale through your nose for a count of 4, but when you do that, let your belly rise out. It's like a balloon, okay? You breathe into it and your stomach comes forward. Let's do this. And when you exhale out of your mouth like you are fogging up a mirror for a count of 6, let the belly soften. Let's go. Again, inhale and exhale. Longer exhales tell your body that it is safe. So, let's do it one more time. And exhale. If thoughts come up when you're doing the breath work, it's okay. Just keep breathing. Each exhale is a message to your nervous system that it says, I am not in danger. After a few rounds, imagine the blood vessel in your body gently softening and not forcing, not pushing, but just releasing. Slowly allow your breath to return to normal like it was before. And now notice how your body feels just right now, right after just doing 2 to 3 rounds of this great breathing technique compared to when we started. You have more space, you're probably more at ease. This is why breathing matters. This is why your body isn't broken. It's responding exactly as it was designed to, based on the signals you give to it. And when you change those signals, your body can change the response as well. So if this helped you, try practicing this once or twice a day, especially in the morning and before you go to sleep. And if you're taking medications, please keep taking your medications. Listen to your doctors, but understand that breath work is support, not a replacement. If you want more videos on breathing, nervous system healing, and trauma-informed tools, please like and subscribe and stay here with me for one more breath work. Put the hand on the chest and on the stomach. Let's take a deep inhale through the nose. And now exhale out of the mouth longer and bring the stomach in. And I'll see you in the next one.